Hello everyone, I'm Dr. Kenneth Muganga, the Chief Medical Officer at Mobi Clinic. As we celebrate International Women's Day this year, Mobi Clinic has a special message for all the ladies out there. Today, we're going to talk about sexual and reproductive health. This is the first of a series of videos where we shall be focusing on different topics regarding sexual and reproductive health. Sexual and reproductive health is one of the most pertinent issues pertaining to women's health, and yet one of the most neglected. As a matter of fact, in our country, Uganda, up to 60% of women do not have access to quality sexual and reproductive health services. Today, we're going to focus on cancer of the cervix, what we call cervical cancer. The cervix is part of the female reproductive tract, the gateway into the uterus. Cancer of the cervix in Uganda is the most diagnosed cancer among women and the leading cause of death due to cancer among women in Uganda. As a matter of fact, 30 out of every 100,000 women die in Uganda annually from cancer of the cervix. In spite of the fact that it is the leading cause of cancer deaths in the country, it's one of the most preventable cancers. Cancer of the cervix develops after years of an infection, a sexually transmitted infection caused by the human papillomavirus, what we sometimes call HPV. HPV is sexually transmitted, and unfortunately, it doesn't show any symptoms. When the disease is much advanced, other symptoms could come in, which might relate to the disease having spread to other parts of the reproductive system. We might have back pain, pain in the lower limbs, paralysis of the lower limbs, swelling of the lower limbs, reduced urine output. All these are symptoms of the cancer having spread to other parts of the body. To protect ourselves from cancer of the cervix, first and foremost, for the young ladies out there, we need to delay the sexual debut. Wait several years before having sexual intercourse. The second point is, for those who are sexually active, you need to have one sexual partner and be faithful to that person. For those who have more than one sexual partner, we need to make sure we practice safe sex. Use a condom at all times to prevent the spread of the human papillomavirus. To protect ourselves from cancer of the cervix, the first thing we need to do is to go for vaccination against the human papillomavirus. All girls below the age of 15 in Uganda are encouraged to take 2 doses of the HPV vaccine. Then for those who are 25 years and above, we are supposed to do screening for cancer of the cervix. This is done once every 3 years from the age of 25. In addition to vaccination and screening, we encourage practicing the ABC model of prevention. Abstinence from sex, being faithful to one sexual partner, using a condom to ensure we are practicing safe sex. To get more information